Thank you, Julie. And thank you for all your great work and leadership. And I have to say, Jeff and Jenna, this is by far one of the best virtual conference I've ever have attended, and one of the best conferences I've ever attended. So thank you so much. I have prepared some words that I'd like to share with WSPHA's board and with their members. So here we go. Madam Outgoing President, members and staff of the WSPHA board and WSPHA members, it is with endless gratitude and thankfulness for the support and confidence you have given me to continue the great work of WSPHA and to advance our efforts through these challenging times in public health. I humbly accept this responsibility and want to assure everyone that I will passionately and tirelessly work hard for WSPHA to make a difference and for us to be at the center of the work that is required for the health and well-being of all Washingtonians. I hope you have enjoyed this year's conference as much as I have. From Imran Ahmed last Wednesday to Montrese Ransom and the panel on equity on Thursday, to Lori Jenkins and the panel discussion on policy on Friday, to Dr. Shaw yesterday, to Donna Levin and Jennifer Piat and the panel today on politics and public health. This truly has been an incredible conference with amazing and awe-inspiring speakers. I want to thank our sponsors for their generous donations. This conference could not have been possible without their gracious contributions. I would like to thank our platinum sponsors, the University of Washington School of Public Health and Washington State Department of Health. Our gold sponsor, Protect 17. Our silver sponsor, Washington State Hospital Association. Our bronze sponsors, Coordinated Care, Seattle Children's Hospital, Washington State Association of Local Public Health Officials, and our contributing sponsors, GMMB, Public Health Center for Excellence, Washington State Center for Nursing, Washington State Dairy Council, and Within Reach. I would also like to thank all the members of the conference committee, specifically their chair, Seth Doyle, for their efforts, time, and all the meetings they attended to help coordinate and select all the sessions and speakers. I would like to thank Jenna Wilson, WSPHA's administrative coordinator, for all her assistance, note-taking, and her ability to keep us organized. And last but not least, Jeff Ketchel, our executive director. Jeff, you've been incredible to work with. Your passion and commitment to public health is like no other. You're one of the most hardworking and honest people I know, and you do everything with a smile. I love talking public health with you. You're not only a great colleague, but you are a great friend. You worked endlessly to assure this conference was organized, seamless, and successful. I look forward to working with you this coming year. To the conference committee, Jenna, Jeff, from myself, the board, WSPHA's membership, attendees of the conference, and speakers, with much gratitude and appreciation, thank you. Lastly, I would like to thank our outgoing president, Julie Osgood. Julie, it's been an honor working with you, and I want to thank you for your leadership during this past year, a challenging year for public health indeed. You led our board and association with grace, integrity, focus, compassion, and optimism. Through your great leadership, Washington State Public Health Association has been a leader in our state against a foolish and needless attack on public health and science. The success of WSPHA would not have been possible without your leadership, all your hard work, and the contributions you made to public health in the state of Washington. You have set a high standard, and I plan on continuing the great work you started, specifically advocating for what is needed to address COVID-19, championing programs and resources to support the public's health, providing opportunities for public health leaders and partners to collaborate on improving health outcomes, and lastly, efforts to eliminate health disparities. As stated, my name is Adrian Dominguez, and I would like to take a few minutes to introduce myself and tell you a little bit about who I am. I'm an epidemiologist, and I've been a public health professional for nearly 30 years. Presently, I work as the Chief Data Officer for Seattle Indian Health Board Urban Indian Health Institute, which is a federally qualified health center and a national research institute recognized as a public health authority. Not only do we provide clinical clinical, dental, behavioral health services to those who access our resources in Seattle, but we also work with 72 American Indian and Alaska Native programs throughout the US in 50 metropolitan areas in 27 states. I oversee several teams responsible for all the data elements, including data infrastructure, data science and informatics, data analytics, surveillance, epidemiology, and research for the organization. I am the son of two proud immigrants from Mexico, Leonard Dominguez from Chihuahua, Mexico, and Josephine Dominguez from Guadalajara, Mexico. I'm the youngest of 5 children and was born in Los Angeles and grew up in East LA. For those of you who know Los Angeles, you know that this is a tough place, plagued with poverty, crime, drugs, gangs, adverse childhood experience, etc. At the age of 12, my parents decided to send me away to school for a better education and opportunity. Each day for 6 years, I took a bus for 2 hours to Pacific Palisades, where I went to school, and then 2 hours again on a bus back to come home. For those of you who know Pacific Palisades, you know that this is one of the most affluent and privileged areas in Los Angeles. These were difficult times for me. Each day a different experience. I was alone. I had bouts of anxiety surface daily because I did not know what each day would bring. Obviously, I did not know my lived experiences during my childhood would prepare me for my public health career and provide me with an understanding that gave me a greater insight as to why my family, my population, had worse outcomes than the populations where I went to school, why certain people live longer than others. I did not know that these were social determinants of health. I did not know that what I experienced and witnessed were prime examples of disparities, inequities, trauma. I tell you this because it's been almost 40 years and I'm still seeing the same thing. This talk of disparities and inequities is nothing new. Our indigenous communities, our communities of colors, our impoverished communities, communities that have been plagued by substance misuse, disabled communities, communities that have been abandoned, refugees, etc., have been hit hardest by COVID-19. This pandemic exposed the gaps of disparate health outcomes, the grave differences in opportunities and resources due to social and structural behaviors, and most importantly, the lack of preparation and strategies to protect our vulnerable populations. In fact, conditions are getting worse, not better. We are seeing the assault of public health authority by elected officials deciding on irrational COVID-19 measures. This has a greater impact on our Black, Indigenous, and people of color communities. However, despite what looks grim, I have hope. I believe Washington State is a leader in public health. And although there is much to do in our state, we recognize that public health is essential to our health and well-being. We acknowledge the importance of public health. We also understand that limited public health resources and capacity perpetuate those disparate differences we have identified. I moved to Washington State 14 years ago. I moved here because the public health arena included more than just traditional public health agencies. It included engagement with community partners, organizations, hospitals, and other traditional public health agencies. Washingtonians believe in science. They believe in data, in public health professionals with years of expertise. And more importantly, public health professionals are willing to challenge the misinformed and the status quo. We support one another and defend apolitical good judgment and scientific evidence. We engage existing racial, ethnic, community-based organizations. We recognize that these organizations are familiar with their communities and are viewed as trusted sources of information. It is them that can facilitate resources and services needed for COVID-19. This coming year will be challenging, probably demand more of us than we have seen in the last couple of years, require us to be innovative to preserve the public's health. It will not be easy, but we did not get into this profession because it was easy. We pursued a career in public health because it is hard and because we want to make a difference. We are a resilient profession. In closing, I ask that each one of you challenge yourself and reflect on the work you have done and the work that still needs to be done. Determine your why. I ask that you get involved in WSPHA. Support your local health departments. Support Washington State Department of Health. Support your community-based organizations. Mentor a young public health professional. Washington State is capable of doing great things in public health and setting the standards for the rest of the country. I promise WSPHA will be at the forefront supporting your public health efforts. Alone we can make a difference, but together we can make changes. I hope we can be together next year for our conference, and I look forward to meeting many of you in person. Thank you.
Thank you, Adrian.
Jeff, I'll give it over to you. I want to thank everybody. I'm getting a little emotional here, but thank you for this opportunity.
There we go. All right. Well, thank you, Adrian. Those were tremendously inspiring and exciting to work with you for this coming year. Julie, my gosh, what a year it's been. Thank you for being there, for believing in me and Jenna, and leading the organization and keeping the ship going. Heather and Joanne, miss you. I'll miss you guys. Heather, you're such a great friend. You brought me on board, and it's been a good home for me to be wild and crazy and as I like to be. So it's I look forward to the coming year, and thank you, board. Such a great group to work for and work with. So I view you all as my colleagues, and it's fun to work with your colleagues. So thanks for supporting us in this conference. I'm glad it went well. I had a couple moments of fright and fear and sleepless nights, but here we are at the end. I look forward to good night's rest, but the work doesn't stop. There's lots to do the rest of this week. But anyway, thank you, board, and President Dominguez, if you'd like to close the meeting.
Yeah, I'm just looking forward to this year. I think it's going to be a lot of hard work, but I'm hoping that, you know, we are going to be able to come back together. I'm hopeful that we will be back together next year for our conference. Like I said, I mean, these are challenging times, but I think we as a group, public health professionals, and I'm not just talking about public health as in like state and local health jurisdictions. I'm talking about public health in general, like the doctors, nurses, administrators from hospitals, clinics, you know, schools, you name it. That is public health. And so I just looking forward to bringing that all together and to doing some incredible work. These are incredible people here. I'm looking forward to this coming year and the work and the difference that we're going to make. So thank you guys. I really appreciate this, and we will see you next year.
All right. Have a great evening, and
Thank you.
We'll see you around, and we'll get the videos posted as soon as possible. All right.
Thanks, everyone.